were a teenager again. Your parents are still in charge of you, and they decide to put you in an abusive treatment facility. You're put there against your will, and you can't sign yourself out because you're a minor. You're trapped, and no one can help you. This topic hits close to home for me because in my adolescence, I was sent to Teen Challenge, a Christian lockdown facility for troubled teens. This was an extremely traumatic experience which resulted in PTSD. I had my rights and freedoms stripped from me. I had to remain in shackles for a month straight for being considered a flight risk. I wasn't allowed to talk to my parents or anyone else I knew. I wasn't even allowed to go outside. In light of the recent election, our new Vice President, Mike Pence, made this statement on his congregational campaign website in 2000. Resources should be directed toward those institutions which provide assistance to those seeking to change their sexual behavior. This shows his support of conversion therapy, although he later denies it. Conversion therapy and religious lockdown treatments can be harmful to the patient's mental health and well-being. I'm going to explain what conversion therapy and religious lockdown treatments are, why these practices are dangerous to the well-being of the patient, and how to change these unethical practices. What is conversion therapy and religious lockdown treatment? Conversion therapy is intended to change someone's sexual orientation or gender identity. Conversion therapy can involve violent role play, electroshock therapy, and repulsion reprogramming. Conversion therapy is based on the false idea that homosexuality is a disorder that can be cured, although this has been proven to be false. Christian lockdown programs are not targeted at changing someone's sexual orientation like conversion therapy is, but they are open to teens who struggle with drug abuse, mental illness, standard teenage rebellion, or even if their parents just want to get rid of them. These facilities are more often than not unlicensed and are based on healing by faith. George W. Bush put in protection for these programs while he was in office. He created the White House Office of Faith-Based Initiatives. These offices were tasked with a bold mission to lower the legal and institutional barriers that prevented government and faith-based groups from working as partners. George W. Bush, the White House Archives. This eliminated regulatory checkups and other obstacles for faith-based organizations. Teen Challenge is the most popular faith-based healing program, and it was a program that I was forced to attend. There are over 200 Teen Challenge locations in the United States and 1,060 in the world. Teen Challenge was started by David Wilkerson. He purchased the first Teen Challenge building in 1960. It started as a Christian rehab for drug and alcohol problems, but at the beginning it was voluntary admission, and over the years this changed. David Wilkerson co-wrote the book The Cross and the Switchblade, which was his personal testimony about the start of Teen Challenge. It was published in 1963 and later became a movie, Teen Challenge USA. Teen Challenge has many different residential locations. Most locations have a 15-month minimum because of the belief that it takes 15 months for rehab to stick. But today, Teen Challenge is far from rehab. Now that I've explained what conversion therapy and religious lockdown treatment is, I will explain how harmful and dangerous they are to the patient's well-being. Why are these practices dangerous to the patient's well-being? The negative effects of conversion therapy are significant. According to the American Association of Pediatrics, LGBTQ+ people suffer from the homophobia and transphobia inherent in conversion therapy. This marginalization negatively affects health, mental health, and educational experiences. Conversion therapy does not work, so along with the dangers toward health, mental health, self-esteem, and suicidality, the patient has the risk of blaming themselves for not being able to change. Teen Challenge believes in only faith-based healing program, which is ineffective as a rehab treatment. Teen Challenge refuses to use any 12-step regimen or trained mental health regimen. They take their patients off of any previous medications that they were on, believing that God is the only thing that can cure mental illness. According to the Medical Whistleblower website, as exempt faith-based drug treatment centers, Teen Challenge facilities are not required to have licensed chemical dependency counselors, conduct staff training or criminal background checks, protect client confidentiality rights, adhere to state health and safety standards, or report abuse, neglect, emergencies, and medication errors. Patients of Teen Challenge and other religious lockdown treatment facilities are denied contact with their parents and anyone else they know, which takes away their social support circle. If you are a minor, your parents can still place you against your will. Conversion therapy is still legal in 48 states, although it has proven to be ineffective and harmful, according to the American Psychiatric Association. As a minor, your parents are still in charge of your health and treatment. Many parents who believe that their child needs treatment have insufficient insurance and have to pay out of pocket at religious lockdown treatment facilities because it's cheaper. Now that I've explained how harmful these practices are, I will talk about how we can help. How do we help change these unethical practices? While Teen Challenge and other religious lockdown facilities have federal funding, they rely on parent payment and charity. Teen Challenge sits at a booth at grocery stores. If you see one, please do not donate, as you are only supporting abuse. If you know someone considering sending their child to a Christian lockdown program or conversion therapy, please ask them to reconsider and think about the devastating mental health effects that they are submitting their child to. Um, we need to remind ourselves that there's nothing wrong with being gay. It's not a medical disorder that can be cured, and it should be. It's not a choice. We need to provide a loving and caring environment, especially when blatant homophobia is still legal in the United States. In conclusion, there are still unethical and abusive treatment facilities that are backed by law. They don't work, and they're harmful to the patient's mental health and well-being. There have been countless cases of abuse and negligence. No one should stand by idly while children are being psychologically abused. And anyone who tries to force a child to change their sexual orientation must understand that this is unacceptable. Ted Blue, the California State Senator.